Hi, so I want to talk to you today about something that's really, really important within the field of aesthetic medicine and is actually a huge misconception. So as an aesthetic doctor, whenever I tell someone that that's what I do, it sort of brings a certain image in people's mind of kind of big filled lips and high contoured cheekbones and drastically changing the way people look. And that's probably based on everything you see on TV and with celebrities and in newspapers, and that side of the industry is very heavily covered because when somebody changes the way that they look, it can be rather dramatic and rather noticeable, and therefore that's the side that takes all of the publicity and a lot of the interest. Having said that, I probably spend about 80% of my time doing a different type of treatment plan, so I thought I would create this as an educational video just to tell you a little bit more about what aesthetic medicine really is and what the more common types of treatment plans actually are. So broadly speaking, you've got two different wings of treatment. On the one hand, you've got enhancements, and that's changing the way someone looks. So that's going to be either straightening a nose or balancing a side profile, creating a jawline, adding volume to the lips, actually changing a feature on the face to actually help someone who has something that they're a little bit bothered by and they want to get it changed slightly or augmented. The other wing, however, is a restoration treatment. And what a restoration treatment is it's essentially just replacing whatever's been lost. So if we've got a patient who's in their 30s or 40s and they feel like they're looking maybe a little bit tired, or they're starting to notice some of the signs of aging, and it's starting to make them feel a bit, they're a bit aware of what's going on, and they're thinking, what can I do to kind of undo some of the aging process that's taking place? These type of treatment plans perfectly address that, because what you're trying to do is just replace and restore volume at the same type of rate that you're losing it. So the aging process starts from 25 onwards, and due to recent medical publications and recent literature that's come out in the last 5 years or so, these type of treatment plans are always improving because we've got a much better understanding of what's happening at the layer of the bone, for example, and the deep fat and the actual structure of your face. So with cases like this, I can tell by looking at a 35, 40, 45-year-old where they would have lost volume compared to how it would have been previously. And with these type of treatment plans, they're actually very satisfying, not just for me, but for the patients too, because it's very common for a first-time patient to be sat across me, and the natural thing everyone's going to be thinking about is how terrifying it is. They're going to be picturing everything going wrong, they're going to look in the mirror afterwards and they're going to look like a different person. It's all very scary. But having said that, the reality is, due to the publications, we know how the volume loss has actually happened, what we need to restore, and this makes it a very relaxing process for particularly a first-time patient. For that moment when they look in the mirror straight afterwards, my hope and expectation is for them to feel like they look exactly like themselves or how they looked previously just a few years prior. So with these type of treatment plans, that's actually where I spend most of my time, just restoration treatment plans. And I think the understanding of the distinction or difference between an enhancement or a restoration is very important, because this all comes out within the consultation and essentially understanding the exact treatment plan the patient's looking for, which is why that is such an important part of the entire process. So thank you very much for that. I hope you found it useful.